there in KEM hospital with the mother right now, Shiv.
Okay, Surya, thanks for joining us with that update. So action is going to be taken against the mother, Deepika Parmar. I'd like to bring in Dr. Abha Mazumbdar, well-known senior gynecologist with Sir Gangaram Hospital, for an expert view on this. Dr. Mazumbdar, thanks for joining us this evening here on Headlines Today. Ever since we started playing this story, ma'am, people have been calling in and commenting, saying that no matter how bad the situation, this kind of thing where a mother picks up her infant and throws her out of the window of a hospital is simply something bizarre. How do you explain it, considering what you've seen so far?
Well, I'm sure that it looks very gross when you listen to it, but then there is a very important medical aspect which we should not forget. A mother who has had a child, and that also when they have twin children, undergo a lot of postpartum depression a lot of times, and I wonder if this woman was going through that too. As I heard, she has been from a middle class family and she's had a boy and a girl. I don't know what type of social pressures she must have been in, financial or otherwise, to pick up the girl child and throw her. So these two things have an impression on my head, that one could be social pressure, financial pressure, two, she could be undergoing inherent postpartum depression, which is so common, and it is a very well known problem in the West. We in developing countries are still fighting anemia and blood losses and other infectious diseases, and hence we give very little importance to these postpartum psychosis.
That's a very important point that you raised, Dr. Mazumbdar, the fact that here we're so obsessed with the other aspects, the aspects after a woman gives birth to a child. It's so easy to forget that there are so many emotional things involved, there are psychological things involved in childbirth. Let me bring in Dr. Bhavna, a senior clinical psychologist with the Escorts Hospital in the capital. Dr. Barmi, thanks for joining us this evening here on Headlines Today. You've heard what Dr. Mazumbdar had to say. There's a great possibility of postpartum psychosis or depression. Also, this woman, there may have been other aspects, there may have been other things playing on this woman's mind. Only the girl child was killed. What do you make of it from the very little information that has come out so far? All we have is that footage of this woman going into that bathroom and coming out without her child. The child was dead 1 floor below.
I think it's one of the most unfortunate things that we are seeing currently, and there are two aspects to it. One is that we have to evaluate the past history of any kind of untreated depression post-traumatic stress disorder that she was dealing with probably during her pregnancy or in the past where this kind, in the recent past where this conception had taken place, or very rightly said by Dr. Mazumbdar, one thing that we pay very little importance to is postpartum depression, and that happens very frequently, especially in the middle class pregnant women who give rise to girl children, despite the fact that there is so much of awareness on the fact that girl children are doing so beautifully in the world today, not only professionally but also for the caregiving of parents. Despite that fact, there is still a lot of female feticide which is being seen, and this could be an effect of mental health pathology coupled with the kind of strata or the social health pathology that she was going through, in which, being from a lower middle socio-economic strata, probably there was financial strains and social strains that were on her, because of which she decided to keep one child and very unfortunately decided to give up on another child.
Dr. Barmi and Dr. Mazumbdar, I want you both to respond to this, but Dr. Barmi first. All of these circumstances which could explain what happened, at one level this was a monstrous act, at the other level there are so many things which could explain her mental state, the postpartum depression, the psychosis, maybe there were financial problems, maybe there were social problems at play. This is a difficult question, but I want to know what you think of it as experts. Can all of these factors actually be accounted for in the legal proceedings that will obviously now go against Deepika Parmar? Can they be accounted for in that?
See, I would say it's a very vicious cycle, because if you're looking at it only from a social perspective, then of course the legal standing would go against Deepika's decision or wrong decision to have taken this lead of keeping one baby boy and giving up on the baby girl, which is very, very unfortunate. And it is a lesson for all of us that, you know, there has to be gender equality in our mind, in our society, in the nation, in the world. But keeping the mental health pathology in mind, once the psychoanalysis or the psychological report comes about, I think that will play a very significant role in the legal setup also, because if there was a past history of depression or any other mental health concern, or there was a current history of a postpartum depression that comes about, then I think the whole case scenario needs to be studied with a little more sensitivity and empathy, and thereby the legalities of it are going to be slightly different thereafter.
Dr. Majumdar, one of the comments we've been getting from our viewers, one of the consistent comments we've been getting from our viewers since we started putting the story out, is that no matter what the circumstances, no matter how bad things are in your life, what Deepika Parmar did was an absolutely monstrous thing to do to your own child. Do you think there's something there? Do you agree with that?
No, I wouldn't agree fully with that. Not even partly, because if I wish somebody had seen what postpartum depression is, I being an IVF specialist has a lot of access to women who really want to have children, and they may go to any extent to have them, and a lot of multiple birth is very common in my setup. Having twin babies imposes such a lot of pressure on the couple, on the mother itself. It's not only a cause for postpartum depression, it goes into marital disharmony, divorces, any sort of problems, you know. And if postpartum depression, if one can really recognize it early, it can probably stop events there. Otherwise the woman can go to any extent to harm the babies or herself or anything, do anything as drastic as that. So we really need to recognize, look at her with a little empathy, but then as my colleague just said, that we really need to stop a social crime if the intention behind it was to do away with one child. We can understand the monetary strain. 1.5 months in nursery on a ventilator must have drained this middle class couple right away.
And we certainly have to wait and see if the police in Mumbai will be treating Deepika Parmar with any sort of empathy, considering the circumstances under which this monstrous act actually happened. Surya, closing comments from you. What is the police telling you about the possible action that they're going to be taking against this mother?
Well, the police has to take a harsh step here, because the whole cold-blooded approach with which Deepika actually conducted the whole the procedure, the way she actually took the small baby girl and wrapped her up in a white piece of cloth and just went to the bathroom, and then she's out, she just got done away with it, and after that, you know, she's screaming and she's only telling the hospital authorities as to the child has gone missing. So it was done with a very cold-blooded approach and very in a very planned and systematic manner. So that is actually very shocking, and we're all taken aback. So definitely speaks of something that it was to do with her mental setup. Also, she was suffering from some kind of a psychological problem or a postpartum blues or whatever. But at the same time, a crime needs no defense, and at the same time, the police would be holding her guilty and doing the right punishment.
And that indeed is the other side of all of this. Thanks very much for bringing us that update. That was Surya Singh reporting from Mumbai. Also thanks to Dr. Abha Mazumbdar and Dr. Bhavna for bringing us your very valuable inputs, your valuable perspective on something that we in India, we have to admit, don't really understand very much. This may have been a monstrous deed, but there were circumstances that we have to consider before jumping to call judgment on Deepika Parmar. She murdered her baby girl, but what was it that drove her to commit such a horrific crime? That is really worth considering. Up next on the news, the latest